Hi, I'm Dr. Michael Gruttadauria. I'm a chiropractic neurologist, and I'm interested in working with patients that have all kinds of neurological and biochemical issues. And I am very happy to be here with my colleagues, and they will introduce themselves.
I'm Dr. Lauren Altchiler. I'm a PhD clinical psychologist, and I specialize in stress management, treatment of anxiety and depression, and recently I've gotten really into integrative psychology, incorporating the role of gut health in mental health, and just integrating diet and more lifestyle issues into my practice.
And I am Dr. Robert Goldman. I am a psychologist. I'm also an attorney, and I am very interested in addressing anxiety and depression in terms of context. That is, anxiety and depression is just a symptom, and getting to the why and really understanding why people are feeling the way they feel and getting to the root cause of it. So that's really what has driven me towards this practice.
Yeah.
So, I'll get started because the frustration over many years for me has always been we always talk about stress, but we never really relate how it affects the body. So a patient will come in and they have migraine headaches, for instance, and we'll talk about why they have migraines, and maybe they have had a concussion, maybe they don't. Sometimes they just wake up and it just begins, and then we talk about stress and they say, I have a stress level of 9 out of 10. What is stress? And how come we're not discussing this together? Where is the emotional piece, and how does that relate to doctors that actually treat physical problems? And this is a real concern, and that's why we're together. So maybe you can address what is stress. It's a good place to start.
Well, stress is really any change. Anytime the body has to make a change in response to a stimulus, the body is under some sort of stress. And what's interesting and comes to my mind when you were saying what you were saying is that, we all say all the time that we're stressed. And we sort of it's sort of like, yeah, I'm stressed. It's almost a badge of honor. I'm stressed, and I might be more stressed than you are. And if somebody talks, it's like, oh yeah, me too. And it just sort of becomes like, I'm stressed and I should do something about it. But I don't think anybody really knows where to go or what to actually do about it. And people say I'm stressed, and they know it's having a negative effect on their body. They could see the diseases coming, the yelling at their kids, their family is a mess, they're developing disorders, but maybe they don't know where to go or don't actually realize they need to grab hold of that and make a change, and that they can actually change something, and it is completely within their power. We have a stimulus, and then we have our thoughts, and then we have our reaction, and what happens when we have that appraisal factor, we're having those thoughts, we have a lot of power in that moment, and most people are not very mindful of the power they have to actually choose differently. Very stuck in our patterns.
And I think, we have a very disempowering model where, we think we could take a pill or do something to deal with the stress and anxiety. And I think teaching our patients how to deal with stress is key. But what I find really interesting about stress is that it's all relative. In other words, what some people define as stressful, like practicing law, others would not. Because we have different thresholds of what motivates us. Because in certain situations, stress is good. Stress is necessary. It's the fight or flight response that when we feel threatened, back in the day when we were being chased by wild animals, we needed that stress response to move, to become mobile. But now we are in a state of chronic stress, and no longer are we threatened by the existence of wild animals chasing us. It's, to me, now been our reputation and what others think about us. That now is our attack mode, and we are constantly being attacked. That's our perception, and having that perception means that it's a state of chronic stress, and that's where it's so unhealthy because our bodies are not wired that way. And Dr. Mike, I'd like to hear your response in terms of what chronic stress does to you from a biological perspective. Because when I met you, you know, I was focused solely on the psychological, but the biological response to stress is so tied to the psychological, and that's to me where they overlap. And you know, educating myself and learning about the stress response in terms of our bodies and how that's tied to all of the diseases and the illnesses that we suffer with.
So stress from a physical perspective is really a neurological component. The brain has different divisions, and one of them is called the autonomic system. The autonomic is like the automatic system that happens inside of us when we're not looking. And a very small percentage of that is called the sympathetic nervous system, and that's the fight or flight mechanism. And then a much larger part is the parasympathetic nervous system, and that's like rest and digest. So our body is used to, in an appropriate situation, being in rest and digest 98% of the time, and once in a while we'll shift into sympathetic drive, and we'll get stressed in some capacity, and we will have this change. That change causes our heart rate to increase, our lungs to increase in respiration, our blood pressure to change. Blood gets shifted out of our gut and into our muscles, so we're ready to make some, take some kind of action. So the body doesn't really understand the difference between bad stress and good stress. So when we're under chronic stress, our body is neurologically changed, and over a long period of time, we end up with an adrenal situation, because now our bodies are releasing tremendous amounts of cortisol, and then that changes our sleep pattern, it changes our blood sugar regulation, and all things kind of go out the window. So there's a gigantic relationship of stress, but when people come in to see me, they usually are only talking about the physical, and they don't really necessarily make the connection that stress is a direct causative factor, and we need to hit this from both sides. If we don't work on stress, all the work that we do physically is not necessarily going to make a difference, and that's a big frustration. And what I see when people come in and I ask them about their stress and I ask them about their emotionality and how happy they are, very commonly they say they're really not that happy and they're very stressed. But I think, from a non-psychologist perspective, I think that people have a stigma about going for therapy because they think that they need to be broken in order to go for counseling. Like, it's almost like I'm acknowledging something's wrong with me to work with a psychologist. When, and I dispel that with every single patient, that's just not the truth. We were never taught how to deal with stress. We weren't given that type of education on how to manage and cope with certain situations. So, how do you actually teach somebody what stress is and how to manage that in their lives?
Well, personally, I find my 7-week stress management workshop to be a very effective way of doing that. And we kind of break it up each week. There's a different topic. The first week is all about what is stress? How are we, interfacing with stress all the time? What are our choices? Are we even motivated to stay in a stressed, state for a whole lot of time? And how is that harming us? And what are our choices? Because a lot of people say to me, I'd love to join your stress management workshop, but my life is stressful. How is anything going to be different? Right. My life is still going to be stressful. I'm still going to live on Long Island. I'm still going to have this job. I'm still going to have 3 children. And the first week is all about, what is our power to within that?
Absolutely.
And then we take it to different things. Obviously, the breathing techniques, mindfulness techniques, meditation. That's a big, big part. And so we do a whole week on that. And then all the following weeks, we do a small meditation in every workshop. And a big thing I find is assertion. People really don't know how to advocate for themselves. They think if they speak up, they're confrontative. And that disease to please, that I really don't want to make waves, is such a huge stressor. I don't want to speak up and tell my parents I don't want to do that for a living. I don't want to tell my spouse that this is going on. And so they're holding this tension. They're holding these stressors all the time. So while it seems like, I know how to communicate, well, a lot of us do, but in certain circumstances, we're actually stifled and we're being passive. And so that's a very powerful week. Then we spend a week on time management. What else do we have?
What about priorities?
Priorities. Well, that's part of time management.
Yeah, because if my job is my priority and my job is causing me stress and my health is not my priority, how do I expect to get healthy?
Yeah.
You
Well,
know,
I
like
think
we need to
that's-
challenge these paradigms, right?
Yeah.
Right, and I think it's really important that we attack stress on all levels, from a, biological and food perspective, from a mindset perspective. Like you say, how you perceive an event depends upon how you perceive it as a stressor.
Yeah, and that's that self-talk,
Right,
that whole the
and
belief system that
right.
we have.
And that's the empowerment model that you talk about.
Yeah.
And also, I think it's the culture, from the particular job. So, like, take a lawyer. A lawyer is trained in the adversarial mindset. So everybody is your enemy, and you have to fight them. And then you have to fight them with zealous advocacy. And then, it kicks off the emotional mind when you're representing clients, because it's so near and dear to them. So you're fighting that emotional part of their brain, which is all limbic system and not really thinking about the consequences, and it's stress induced. So a lot, and it's documented how much lawyers struggle with addiction, because of their stress and anxiety. It's an epidemic, not just with lawyers, obviously. I mean,
Yeah.
I think anxiety is the new norm.
It is.
You know?
And I'm seeing it earlier and earlier. I know when I started my practice back in 1992, I didn't see 13-year-olds with anxiety. I see now the middle school age is when the plague hits them. The social anxiety, the social media now is adding a whole other piece to these kids' lives. That
But also
we just
our
didn't have to
environment,
deal with.
our lifestyle and our environment is different.
Oh,
You know,
yeah.
kids are inside, almost all the time. They're very sedentary. Their diet is different. We were born to be outside. We were born to eat and fast. Like we're like lions. We would eat an animal, and then we might fast for 5 days before we would find more food, and our body gets to recycle during that fasting period. And we have a hard time fasting between breakfast and lunch, so we never experience that fast. And so our body changes. And so why do two people that have the same situation, the same job, for instance, one experiences significantly more stress than the other? Well, there's a physical component too. How much inflammation do they have built up? What is their gut-brain connection doing right now? So we really need to kind of break everything down and look at how much of this contribution to their situation is emotional and mental, how much is physical, and then work on both sides.
Yeah, that's where I'm really thankful to have you in this practice, because it used to be that people would come in and I only had the psychological tool to work with. And if I'd work with people and we really assess their thinking patterns, assess their stress levels, address those, some people get better really quickly. And then there's certain people that just don't get better with all the logical things that we learn as psychologists to work with. And in the past, we would just get to a point, what would we have to do? We would have to say, okay, it's time to go to the psychiatrist. But now we have functional medicine where we could do, as you were saying before, it's like, what is the root cause? What actually is causing this person to have sort of this physiological anxiety that doesn't really seem to have anything to do with being in one environment versus another, one day versus another? It's like this motor that's running all the time that they can't turn off, or that's being caused perhaps from a gut imbalance, and the neurotransmitters just aren't actually being made because maybe their diet is not supporting nutrient-wise what they actually need. And so this is why I'm so excited to be part of this team, because this is like a whole new
and I totally agree
thing.
with you, because a lot of times I feel helpless sometimes as a psychologist, right? Because we're just dealing with the symptom, but we're not always able to get to that root cause. And I think sanity is an effort, and you need everyone together. I'm very big into collaboration and integration, because to think, psychologists alone can deal with people who are struggling is just, it's not correct. It's not true. We need to work together and be on the same page in any model. And I think that is, I'm so grateful to have met you, Dr. Mike, and you, Dr. Lauren, just to be able to work together and to you know, talk as colleagues about the patients and how we can get together to really help them.
Yeah.
I think at some point there won't be a distinction between the different professions. I think that we will be clinical neuroscientists, and we will be cross-trained in different areas, and people will specialize in certain areas, but they'll all understand the same thing, that there is a mind-body connection, and what is going on in the physiology absolutely affects the mind, and that you can't really separate the two.
Well, I think we're making progress. I mean, the American Psychological Association is now recognizing that the brain-gut connection, and there's a lot more research that's showing that it really is evidence-based work. So, you know, it's exciting, it's promising, but I still think we have a long way to go, you know, because many people are still not educated about, you know, all the benefits that you can do in terms of eating the right way, exercising the right way. I think what you said before, Dr. Mike, about there is a stigma in going to a psychologist, less so going to a medical doctor. So a lot of it we call is somatized, so that we say, we can't say we're mentally ill, but we can say we have a headache, right? But there, if they can't say that, then we're missing the opportunity to really treat.
Yeah.
Excellent.
And then there's just this whole mentality. I know some patients come in, I mean, it's a little less for me, I think, than the average psychologist, because I do discuss online that I'm more integrative and will try to help keep you off meds, so I get fewer this way. But even everybody, not everybody, but there's still the mindset of, let me just go on a pill. It will be quicker. It will be effortless.
Right.
And I think if the pill were the answer, if Prozac was the answer, we would all be out of jobs, and people wouldn't be suffering in this chronic way that they are.
Right. Nobody's got a Prozac deficiency.
No.
No.
And if it was correcting the underlying root cause imbalance, then everybody would just feel well who's on it, and we wouldn't really be needing to have this conversation. But no pill cures this underlying imbalance. These symptoms are signs that there's something underlying that needs to be balanced. Sometimes it's a mental thing, sometimes it's a physical thing, but we have to work together.
Well, that's why I'm glad we're all together. All right.
Yeah.
So we want to
So-
stop it there, and then we'll do another one we'll talk